Hello everyone, I'm Dominic Yuzon from BSRT3 Section 1. For today's topic, we will talk about brain scintigraphy. But first, what is brain scintigraphy?
It is a procedure in which a radioisotope is administered IV and its distribution monitored with a gamma camera.
Brain scintigraphy informs on the adequacy of blood flow to the cerebral cortex and detects abnormalities in the brain before they can be detected by CT or MR scans. The brain is one of the largest and most complex organs in the human body. It is made up of more than 10 billion nerves that communicates in a trillion connections called synapses. The brain is divided into several lobes, namely frontal lobes, parietal lobes, temporal lobes, and occipital lobes. The frontal lobes. The frontal lobes are responsible for problem solving, judgment, and motor function. The parietal lobes. The parietal lobes manage sensation, handwriting, and body position. The temporal lobes. The temporal lobes are involved in memory and hearing. And lastly, the occipital lobes. The occipital lobes contains the brain's visual processing system. The brain is made up of many specialized areas that works together. First is the cortex. It is the outermost layer of the brain cells. Thinking and voluntary movement begins in the cortex. Second is the brainstem. It is between the spinal cord and the rest of the brain. Basic function like breathing and sleep are controlled here. Third is the basal ganglia. The basal ganglia are the cluster of structures in the center of the brain. The basal ganglia coordinates message between multiple other brain areas. Lastly, the cerebellum. The cerebellum is the base and the back of the brain. It is responsible for coordination and balance. The indication of brain scintigraphy. Detection and evaluation of cerebrovascular disease. Aid in the diagnosis and differential diagnosis of suspected dementia. Detection of seizure focus. Assessment of brain death. Evaluation suspected brain trauma. Neuropsychiatric disorder like mood disorder, evaluating and subtyping attention deficit disorder. Substance abuse, infection or inflammation. The contraindication of brain scintigraphy are pregnancy, breastfeeding, and lack of cooperation. Patient preparation. Patients should be instructed, if possible, to avoid caffeine, alcohol, and other drugs to known affect cerebral flow. The most important aspect of patient preparation is to evaluate the patient for his or her ability to cooperate. Achieve a consistent environment at the time of injection intake. Number 1. Place the patient in a quiet, dimly lit room. Number 2. Instruct the patient to keep his or her eyes, ears open. Number 3. Ensure that the patient is seated or reclining comfortably. Number 4. Place intravenous access at least 10 permits accommodation. Number 5. Instruct the patient not to speak or read. And lastly, number 6. Have no interaction with the patient prior to, during, or before the examination. Radiopharmaceutical use for brain scintigraphy. Thallium-201 or TH201 is a radiopharmaceutical use for scintigraphy, primarily of the myocardium. The element thallium is treated on the body as an analog of potassium. It is produced by a cyclotron by bombarding thallium-203 with protons. The instrumentation for brain scintigraphy. Scintigraphy, from Latin word scintilla, which means sparks, is also known as gamma scan, is a diagnostic test in nuclear medicine where radioisotopes attached to drug that travels to a specific organ or tissue are taken internally and emitted gamma radiation is captured by external detectors to form two-dimensional image in a similar process to capture X-ray images. In 120 cases of operated brain tumors, the neurosurgical findings are compared with the result of brain scintigraphy with 99 mTC per technetate. The study comprises only the frequent types of brain tumors such as meningioma, dementia, epilepsy, and traumatic brain injury. From the neurosurgical findings were evaluated the localization and size of the tumor, the extent of vascularity, of cysts, and necrosis. And that's all. Thank you for watching.